The FedLife podcast is presented by Serving Those Who Serve, a fiduciary, fee-based financial planning firm serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of Raymond James. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc. And now, here are your hosts. Dan Sipe serves as a branch manager for Raymond James Financial Services and Serving Those Who Serve. Ed Zerndorfer is our guest and federal benefits expert in the space.
Hello and welcome to this episode of the FedLife podcast. If you don't know me and you're new, I'm your host, Dan Sipe. Additionally, I'm the branch manager here at Serving Those Who Serve and Lee Sipe and Associates. And I am going to begin, as I always do, by saying thank you. Thank you for taking the time to listen. And above all, thank you for your service to the government, to the country, to me, to everyone. You do not hear that enough, but you will always hear it here. The other thing, if you're a regular listener, you know that you will always get on the FedLife podcast is my buddy, the guru, Ed Zerndorfer. He is back once again as part of our ongoing mission to reach, teach, and serve you. Once again, we will follow Ed's FedZone articles. They are awesome. Be sure to head over to the FedZone. That's fed-zone.com and read them. I'll remind you of that throughout the podcast. But this gives us one more way to reach and teach. So if you're a person who likes to listen, we got you covered. If you like to watch, here we are. So Ed, we are firmly heading into open season, and you have a whale of an article that explains all the options within FEHB. So let's play Captain Ahab and land this whale for our feds. So you begin with the different types of plans. I'll list them very quickly, and then you can dig in. So you've got PPO with fee for service, local HMO, high deductible health plans, consumer-driven health plans, and point of service plans. So let's go ahead and jump in. Tell us about them.
Okay, thanks, Dan. I want to say this from the outset, that federal employees and retirees should be aware of the fact that when it comes to their health insurance plan, the Federal Employee Health Benefits Program, a group-sponsored health insurance plan, who is the sponsor of the federal government, there is nothing better out there if you're a federal employee retiree. Just keep in mind, it's a group plan in which the federal government, the employer, pays on average 72 to 75% of the premiums, whether you are an employee or whether you are a retiree. No matter what type of coverage you have, self-only, just you, the employee or retiree, or self and family, you and eligible family members, which include a spouse, any number of children under the age of 26. And there's one other type of coverage I should mention, self plus one eligible family member, a spouse or a child under the age of 26. Again, the government's paying 72 to 75% of the premiums. Now, in terms of costs, there's nothing better out there. Okay, you can't find anything better. When I get these questions from an employee, well, can I do better on the outside? The answer is absolutely not. Absolutely not. It's guaranteed issue. You don't have to go through underwriting. And again, the cost is, bare minimum as far as I'm concerned. And this is coming from someone, Dan, who spent 32 years in the government before I retired, enrolled in the federal employee health insurance. I'm a retiree of the government, been retired now almost 19 years. And I had the federal employee health insurance as my Medicare supplement to my federal employee health, to my Medicare. And I'm also a licensed insurance broker. I see all types of plans out there when it comes to health insurance. Again, it's the best. But that being said, there are some costs involved, including premiums. Now, one of the ways that the federal government keeps down restrains the cost of the premiums is the fact that it encourages employees that when they pick a plan, that they should stay in network to doctors who accept the insurance, and as such, they prefer providers, and they will agree to reduce when they charge a patient, an employee, retiree, or family member, that the cost is not as much compared to if a doctor or a hospital, a lab, something like that, was out of network. So that's one of the reasons.
Gotcha.
So now we can go through the different types of plans. The different types of plans include preferred provider organization plans, PPOs. Now, those plans involve going to doctors who are in network, doctors, hospitals, labs. They need to get a blood test or an X-ray. Then we have preferred provider organizations that are associated also with fee-for-service plans. What are fee-for-service plans? A fee-for-service plan means that someone enrolled in the plan can go to any doctor, any lab, any hospital, and they're going to be subject to the cost of that hospital. They may not get the preferred. The doctor, the hospital, lab will charge regular rates. There's no discounts. Now, that's important if you are in a PPO, because you may have to go to a doctor or a hospital that is not in network. And it gives you that option, as opposed to a straight PPO in which you have to stay in network. Then we have HMOs. Now, HMOs, health maintenance organization. I'm sure many individuals, our employees, retirees, are familiar with those, in which they're basically local. Most HMOs are local. I don't know of any national, well, maybe one, Kaiser, that's a national HMO, in which you have to go to I wouldn't call it a clinic in which all your doctors are located. You have a specialist, and you definitely have to stay in network within the HMO. You can't go out of the HMO network of doctors and providers. And if you do, you could possibly be paying a lot of money. Then we have, and HMOs actually can be broken down to two types. I'll talk more about that in a few moments when I talk about the advantages and disadvantages. Then we have what's called high deductible health insurance plans. High deductible health insurance plans, in which you can go to any doctor you want, any doctor, anything. If you go maybe to a preferred provider, you'll pay less. But the point is, Dan, is that you're subject to a very high deductible before the plan actually kicks in and pays for your expenses. These plans have gotten a little more popular in recent years for a certain reason, because associated with your high deductible health insurance plan is a health savings account, HSA, in which you could pull money out of that HSA to pay for out-of-pocket expenses. I don't want our listeners to be concerned about that high deductible, because high deductible health insurance plans have what's called first dollar coverage. In other words, you don't have to meet that high deductible for things like well visits for yourself and members of your family who are in the plan, for things like mammograms, things like if you have to go to a stop smoking clinic, you're trying to improve, do things, that's covered from first dollars. I'll talk more about the advantages and disadvantages of the high deductible health plans, but I do want to say they're getting more popular. And one of the reasons we're getting more popular, Dan, is because all plans, whether they're preferred provider plans, whether they're fee-for-service plans, are raising their deductibles. That's a fact of life now. And to the point that the difference between the minimum high deductible and a high deductible health insurance plans and just other and PPO rules, it's not that much. So it may pay for many for certain individuals who do not incur a lot of healthcare expenses to maybe consider enrolling in a high deductible health insurance plan. And then we have what's called a consumer-driven high health plan, in which the plan that you're in will reimburse you if you frequent certain providers, will reimburse you if you incur any expenses. The point of a consumer-driven health insurance plan is that the plan is encourage you to be aware of your healthcare expenses and if you don't have to go to the doctor, don't. Try to avoid going to doctors if at all possible, or try to maybe skip visits, things like that. I hate to skip visits. And again, that's for me, when they came out, I'm a little suspicious because, your health is not something that you want to, what I call shop around for. You don't want to go for the cheapest doctors. You don't want to avoid care. This is your health, Dan. Now, it's not like buying a car. Dan, I know you have bought a car many times. I bought a car. And what do? You
Sure.
look around, you find something you like, but then you do some, you have to negotiate prices, things like that. I don't know about this when it comes to healthcare. And we'll talk more about that when it comes to, we were going to talk about the advantages and disadvantages. And finally, we have what's called a point of service plan. In simple terms, a point of service plan is a combination PPO, preferred provider plan, and an HMO. An HMO. I say that because everybody knows HMO, you have to stay in the network. PPO, we talked about earlier, associated with fee-for-service. You can go out of network. You might pay more, but you have that option. It's a combination of a PPO and with a fee-for-service and an HMO. So those are the different types of plans.
Gotcha. And as you great segue, Ed, because your article also talks about some of the advantages and disadvantages for each one. So let's spend a little time on those. So you kind of have on your matrix, you have PPO and PPO with fee for service sort of all on the same page. So let's talk a little bit about the advantages and disadvantages there as you see them.
Yeah. With a PPO, as well as a PPO associated with a fee for service plan, by using preferred providers, one can save a lot of out-of-pocket costs. For example, if you go to a preferred provider, the preferred provider will say, well, here's the cost. I'll take whatever your insurance will pay. You don't have to meet the deductibles. The deductible might be waived. Save some money right there. May not be any co-payment. There may be no co-insurance. But the point you got to be very careful about if you're enrolled in PPO is that you have to check that the doctor is in the network. You got to do your homework. I'm saying that now as we get close to open season, because I remind employees, if you were enrolled in a PPO this current year, 2024, and you want to re-enroll to that PPO, or you don't have to do anything if you're going to re-enroll for a bit next year. You just leave it as is. But don't assume that your doctor that you're using, or your hospital, or your clinic that you go get your lab tests, blood tests, is going to be in the network for 2025. Call them, ask them, are they going to stay in the network? You don't want to have the shock come next January. You go for your annual physical, let's say. You just said, oh, by the way, we're no longer in the network.
That's not good.
That's not going to be good, and it's too late. You cannot change it after open season, after December 9th, 2024. That's it. You can't make any changes.
Gotcha.
Make any changes. So you got to do your homework. So that is definitely something you got to be aware of. Also, if you go out of pocket, go out of network, be concerned about possible catastrophic expenses. Expenses. I'm saying that, Dan, because another advantage of the federal employee health benefits plans is that if you're enrolled in a plan, and that plan is with it has preferred providers, and you go to end up in a hospital that is in the network, you have what's called major medical coverage. What is major medical? Catastrophic, Dan. You're in that hospital for, let's say, 6 months to a year. Dan, how much does a day in the hospital cost?
A lot.
What, $4,000 a day, $5,000 a day? Think about if you were in that hospital for a year. Well, federal employees, federal retirees had nothing to worry about. because they have that catastrophic coverage. That is if you're in network. I cannot say that if you're out of network. There may not be a cap on that. So that's something you need to be concerned about. If someone is going to go out and may be going out of network, I suggest though they're going to be enrolled in a PPO plan associated with a fee for service plan that you can go out of network, that they purchase separately what's called major medical hospital insurance, major medical, catastrophic, to cover that possibility that if they do go out of network, that they have major coverage. We're talking about major medical, Dan, is up to $2 million. If they were in a hospital and had it for a long period of time, they would be covered in an out-of-network possible. You have to buy that separately. It's not expensive. Major medical, because it's like we call this a stop loss. Employers out there who have private employers who run the health insurance plan themselves. They cover coverage. They buy stop loss coverage in case someone has to go to the hospital. One of their employees goes to the hospital for 6 months. They have what's called stop loss insurance that once, let's say, a certain level is reached out of pocket of expenses, $50,000, $100,000. That's when the insurance comes into play and pays for that patient. That's not the federal employee health insurance. But the point I'm trying to make is the employee has to consider that. If they are, let's say, and by the way, the federal employee health insurance plans have some what's called fee-for-service plans. Only fee-for-service, meaning what? You can go anywhere you want, any doctor, any hospital. But you run that possibility that if you're in the hospital for a long period of time, you could have millions of dollars of expenses not covered by your insurance, sure, and you want to be covered. That's why you have to buy separately major medical catastrophic insurance.
Good tip. And now how about the local HMO? What do you see as the pluses or minuses there?
All right. So I'm going to break down the different types of HMOs. And in that column, I break it down. There are two types of HMOs I cover. One is called a facility-based group practice, in which the advantage of being that type of HMO is that the doctors review each other's practices. Enrollees do not have to spend time submitting claims for, also anybody enrolled in any employee or retiree enrolled in does not have to submit claims for costs and services. They are guaranteed access to a group of doctors. Doctors are preventing charging more than the plan will reimburse. Those are the advantages of a HMO facility-based group practice. What is the disadvantage? And I got to tell you, this is, and to me, this is a little bit somewhat upsetting. Some HMOs rely heavily on mid-level professionals, such as nurse practitioners and physician assistants to do their care. I'm not trying to put down nurse practitioners and mid-level professionals, in terms of care. But somebody may say, "Gee, where's the doctor? Where's the doctor?" Now,
gotcha.
The doctor is not available. I'm going to be doing in care of your visit today. Somebody might get upset with it. Again, you have to be aware of it. You have to be aware of that when you're in that type of HMO. And again, getting back to in general for HMOs, keep in mind that HMOs are local. They're not national. So you have to ask yourself the question, if you go out of town, you go out of the country, and you get sick, you get in an accident, what's going to happen? Particularly if you go out of the country.
Sure.
You should consider buying travel insurance.
Gotcha.
Very important.
That's a great tip.
The other type of HMO is called an Individual Practice Association, IPA, HMO, IPA. And the advantage of that, many participating physicians and hospitals, but not as many as the national preferred provider plans. We're talking about, companies like Blue Cross Blue Shield has an IPA. Blue Cross Blue Shield has Care First, Blue Cross Blue Shield, has IPAs all around the country. Okay. Is there any disadvantages? Well, some HMOs rely heavily on mid-level professionals and nurse practitioners and physician assistants for their care. If you are enrolled in Medicare, there are very few HMO IPAs that offer the extra benefits to Medicare enrollees that are found in a Medicare Advantage plans. If you are enrolled in Medicare, particularly original Medicare Part A and Medicare Part B, and you are considering enrolling in an HMO, you should consider a Medicare Advantage plan. We're going to be talking separately about that, I know, coming up in another podcast. But I will tell you, a Medicare Advantage plans has its problems too, and I'll be talking about that. So again, the key here with these IPAs is the fact that if you do go out of town, out of the country, particularly overseas, be prepared. In case you do you get sick, get an accident. There are more national. There are some IPAs that are across the country, so you might be lucky. But again, I would definitely check with your IPA, whichever one you enroll in, that in case you go out of your local area, what happens if you get sick, you get injured, things like that. And if overseas, I recommend travel insurance.
Great tip. All right, now let's go to one that I think you like a lot, which is the high deductible health plans because of how they compare with another vehicle. So talk us through the pluses and minuses here.
Yeah, with a high deductible health insurance plan, I ran some numbers here, and with the federal plans, there are several national federal employee health insurance plans that offer high deductible health insurance plans, including Blue Cross Blue Shield, GEH, Government Employees Hospital Association, among those. And let's go back what I said earlier, that with a high deductible health insurance plan, number one, the deductible that you have, whether you have self-only coverage, self and family, is going to be higher than compared to a per provider plan. For example, Dan, this year in 2024, what is the minimum high deductible for a self-only coverage? $1,400. Self and family, self plus one, $2,800. Now, you would think, Dan, to think logically here, if you enroll in a high deductible health insurance plan versus a low deductible health insurance plan, wouldn't your premiums technically be lower if you're in a high deductible health insurance plan?
I would think yes.
Well, that's not the case with the federal plans. You pay more for your high deductible health insurance plan compared to a comparable plan which is low deductible. Now, why is that? The reason is that a portion of the premium that a federal employee every 2 weeks has deducted from their paycheck, a portion of the government's contribution to the cost of that health insurance plan, that's the 72 to 75% the government's paying. A portion is automatically contributed to the health savings account. Automatically. Why is that? Because the plans want you to start funding an HSA, to use that money in the HSA to pull out for out-of-pocket costs, to help meet your deductible, to pay co-insurance, co-payments, and so on.
Sure.
Now, what I found out is that when you add up the costs of the premiums, and then at the end of the year, you end up have money left over in your HSA. This is another great point about the health savings account. Unlike the other type of spending account, it's called a healthcare flexible spending account. There's no use or lose situation. You carry over the balance in your HSA from 1 year to the next. If you leave federal service, you take it with you. If you retire from federal service, that balance in the HSA can be used to pay for out-of-pocket costs that you incur during retirement, including reimbursements for Medicare Part B and Part D. We'll talk more about that later. Okay. So when you add that and take that into account, that the total cost of the of the high deductible health insurance plan, when you take that into account, and the premiums you're paying will be less. The cost of the high deductible will be less than a classic preferred provider plan.
Gotcha.
That's something you have to consider. But for a lot of employees, that deductible, that's wicked. I'm really worried about that. Once again, though, and remember, you don't have to meet that high deductible for what's called for certain things that are first dollar coverage, including well visits, and
Gotcha.
Importantly, Dan, the amount that you pay out of pocket in a high deductible health insurance plan. This is important. Is capped every year. You have catastrophic.
Nice.
You have a catastrophic limit, which is like maybe $6,000 or $7,000. That's nothing.
Agree.
So you have to take that into account. What is the disadvantage of a high deductible health insurance plan? And then, and also, I'm going to include I'll talk more about the consumer driven health insurance plan here in a moment. But here's the disadvantage, Dan. This has me concerned that those individuals who enroll in high deductible insurance plans, and they want to build up that HSA balance, they're going to avoid going to the doctor. If they have a certain ailment, I can take care of myself. I don't have to go see the doctor. I don't want to have to take money out of my HSA to pay the doctor. We're not talking about routine visits. We're talking about, we all have sometime we have to go to the doctor. Should I go to the doctor?
Sure.
I'll just go to my local drugstore, get some medication, some over-the-counter stuff, and I'll take care of it. That could lead to problems. That could lead to real problems. So that has me concerned that people will avoid, in order to save money in their HSA, they know they can carry it over. They're just going to avoid having to go to the doctor or the hospital or whatever, or to the clinic to save money. And that has me concerned. With a consumer-driven health insurance plan, you do not have anything associated with like an HSA, but you have a substitute. It's called a health reimbursement account, an HRA. The HRA is different than the HSA in the following sense. Number one, employees cannot fund the HSA. They can't put tax-deductible contributions in the HSA. The HRA is funded by the agency the employee works for.
Gotcha.
Okay. And there's no carryover. Any money you don't use in your HSA for 1 year to the next, you're going to lose it. You can't take it into
Meaning the HRA.
The HRA cannot take it into retirement.
Okay.
And finally, we have the point of service plan. Okay.
Yep.
The advantage of a point of service plan, by joining a point of service plan, okay, essentially you're really joining an HMO with a fee preferred provider plan, meaning that even though you have to go to doctors within the HMO, you can go outside the HMO, and if you go to doctors who are preferred providers, you save money. It's a combination. And again, this is particularly useful if you go out of town. If you leave the HMO, you just go out of town and you go to doctors in the plan that are preferred providers, and you'll be able to save some money that way.
Nice.
Disadvantages.
Nice.
What's the disadvantage of a point of service plan? I say this: enrollees have to, quote unquote, do their homework. What do you mean do their homework? They have to consider, if they go out of network, if they go outside the HMO, is the doctor they're going to be using or hospital a preferred provider? Okay. If they're not, they're going to be paying more money.
Gotcha.
Got to do
Woo! That's a lot. But folks, as they say on the game shows, but wait, there's more.
Yeah. Well,
so Ed, you have some suggestions for our feds to consider this open season. And you open with some data on studies on the topic as far as how people are actually behaving. Tell us about that.
Yes. I just want to say one thing about this column, Dan, that I encourage everyone listening, whether, whenever, to check the column itself, the column I wrote,
Yep.
I think it came out October whatever it is. Just go to the FedZone. It'll be there. It's entitled Federal Employee FEHB Program Health Plan Types and Options. Again, www.fed-zone.com. And one of the things I did, I think you mentioned this, Dan, that I have a matrix of all the plans explaining what the name of the plan, the medical provider flexibility, how much flexibility you have with each plan, cost controls, and the advantages and disadvantages of each plan. It's all there. Right there. They can review it for themselves.
Absolutely.
Okay, so let's talk about some recommendations when it comes to choosing or changing FEHB plan, health plan for plan year 2025. Just want to mention again that during the open season, which again is going to be occurring between November 11th, 2024 and close of business December 9th, 2024, an employee or retiree can change their plan or choose another plan. I say choose a plan. That's if you are new to the federal government and you didn't sign up during your initial 60-day period. Now is the time you can actually get into the Federal Employee Health Insurance Program during the open season. I want to also mention, this is important, Dan, that if you are an employee, and you change your plan or you're enrolling for the first time, your coverage will not take effect until the first day of the 2025 leave year. What is not January 1st? That happens to be January the 12th, 2025. That's the first day of the 2025 leave year. That is for employees. If you are a retiree and you change your plan, when does your health insurance plan become effective? January the 1st, 2025. That's important. Please keep that in mind, ladies and gentlemen. All right.
Important distinction.
Okay. Just before we get into the specific recommendations I have, I want to share with you some results of some past studies over the years. Studies over the past have shown that a sizable percentage of federal employees often automatically choose low deductible health insurance plans. They want to go into low deductible. Low deductible, again, meaning they pay less out of pocket compared. They're going to pay before coverage takes effect compared to high deductible. And it also means they're going to be paying higher premiums, low deductible. Okay. Other studies found that many employees stick with the same plan. They don't make any effort to change their plan. Okay.
Yep.
They don't want to go to the bother of evaluating the options each year and choose a better plan. The result is higher premiums each year. Give an example, Dan. Keep in mind that in 2025, the average premiums for federal employee health insurance plan are going to be increasing by 13.5%, the largest increase in years. We've been spoiled. I say we've been spoiled. I'm a federal retiree. Okay, we've been spoiled. So this is the time, if you're enrolled in a plan, you got to do an evaluation. Okay, so let's go to this, what I consider. So I have 7 suggestions to consider when choosing or changing your health plan offered to the federal employee health insurance. This is true whether you are an employee or retiree. Number 1, consider you, the employee or retiree's healthcare needs, and if you have family members, spouses, children under 26, what specific healthcare needs do you have? Because each plan may have, has different things they pay for. They might have things that have to be paid for, in your case, more. So that's the first thing. Okay. Number 2, check a healthcare plan's premiums, co-payments, deductibles, and annual maximum out-of-pocket costs. I was mentioning a few moments ago. One of the real advantages of FEHB plans is that they have catastrophic limits. The maximum you got to pay out of pocket, which includes deductibles, co-payments, and co-insurance, things the plan won't pay for. You are capped. Here's something that's very important. Remember that the health plan with the lowest premiums may not necessarily be the most efficient option in the long run. Don't let the low premiums be the only determining factor. That's what I'm saying. Okay?
Yep.
It's essential that when you choose a health insurance plan to not enroll solely in premium costs, you have to also consider out-of-pocket costs to consider, including co-payments, deductibles, out-of-pocket maximums. Remember, once those out-of-pocket maximums is reached, the health plan covers 100% of all costs. What is that catastrophic limit? How much do you want to pay out of pocket? What is the maximum? Okay?
Absolutely.
Okay. Number 3, check your provider networks. This is important. If you're not doing the HMO thing, you're doing a fee-for-service plan, PPO, high deductible health insurance plan. Check those preferred provider networks. You could save a lot of money by staying in network. Number 4, consider health savings accounts, the HSAs. I love those things. And I will be writing several
So do I.
1 or 2 columns on the HSAs. I love HSAs. They are here to stay, Dan. They are here to stay. Okay.
And they should be. They've earned their place.
They have, definitely. Thank you. Number 5, please know the difference between HMO and a PPO. Know the difference between, remember HMOs, you're totally restricted to the doctors in the PPO, in the HMO. But we provide PPO, particularly those that are associated with, you have more flexibility. If you have a favorite doctor, you have a favorite specialist, whether it's a internist or a hematologist, whatever, cardiologist, even if you're going to keep the same plan for 2025, please, sometime during opening, call your doctor's office, contact them, and ask them, ask the doctor's office. You don't have to talk to the doctor. Just say, is the doctor going to stay, as a preferred provider in the plan, the plan I'm in for 2025? If they say yes, you're good to go. You're good to go.
Yep.
Not also your hospitals, also your clinics. You have your president. Call them. The phone call is free. And if they say no,
Sure.
we're not, then you have to go. You have to consider maybe a different plan. Also,
Gotcha.
along the same lines, I've seen this happen where someone has, let's say, they're enrolled in a plan that has basic standard coverage. They have standard, like for example, Blue Cross Blue Shield standard or GEHA standard, and they, for some reason, say, I had a good year. I think I want to go down to basic. I can save on premiums. Some doctors will only take standard coverage. When you go down to basic, they say, sorry, we're not going to accept it. We're not going to be a preferred provider then. Again.
Yeah.
And that's, again, back to the phone call. Ask the doctor's office. Do you accept, if I'm currently in Blue Cross Blue Shield standard. I'm going to go down to Blue Cross Blue Shield Basic. Will the doctor accept that? No, because the doctor only accepts Blue Cross Blue Shield Standard. Keep that in mind. Number 6, your medications, your prescription.
Oh, yeah.
Okay? Are they covered by your plan? That could change from one year to the next. Some of the plans are now encouraging or doing it on their own. They say they say, okay, if you are eligible for Medicare, we are going to now we're going to put you into what's called a prescription drug plan associated with Medicare Part D. The prescription drug program, Medicare Part D, covers certain prescription drugs. It's called a formulary, Dan. You might be on a medication that is not part of the formulary. You better check.
Absolutely.
Again, this is something that has to be done during open season. And finally, okay, all right, if someone does not want to enroll in a high deductible health insurance plan associated with HSA, you want to stick with a regular preferred provider plan, HMO, point of service plan, fine, but please consider enrolling in a healthcare flexible spending account. Why am I saying that? I don't care what health insurance plan you're in. You could be in the Federal Employee Health Insurance Program. Let's say you are a military retiree and you have TRICARE. Okay? TRICARE Prime, TRICARE Standard. You might be married to someone who works for a state government, local government. You're enrolled in their plan. Maybe your spouse works for an employer who has a great health insurance plan. What's my point? There is no health insurance plan out there that pays for everything. You're going to have deductibles. Sure. You're going to have co-payments. You're going to have co-insurance. You're going to have things that the plan doesn't pay for. So the question is, how do you pay those? Increasing health insurance, the deductibles and co-insurance and co-payments and things it doesn't pay for. Through a tax beneficial healthcare flexible spending account, a healthcare FSA. Because with the healthcare FSA, Dan, you're setting aside from your salary, from your gross salary, before all taxes taken out, money that will be used to pay for these out-of-pocket expenses. If you don't have a healthcare FSA, you're going to have to use after-tax dollars to pay for out-of-pocket expenses.
There you go.
It makes it, and if you are a federal employee, during 2024, for example, you could set aside as much as $3,200 into a healthcare FSA. It's going to go up in 2025. IRS hasn't come out with the announcement. My guess is, I'm usually not in the prediction business, but it'll be a minimum $3,300, probably $3,400 you can set aside. If you're married to someone who's also a federal employee, they can also set aside $3,400. That's a total of, $6,800 that could be used to have help reimbursed for your out-of-pocket expenses for members of your family, who are, whether they are enrolled in federal employee health insurance or not. Again, you do not have to be enrolled in the Federal Employee Health Insurance Program in order to put money into a healthcare FSA. Keep in mind, though, a couple downsides about the healthcare FSA. It's a use-or-lose situation at the end of the year. You can only carry over a certain amount of money. Once you retire, you cannot have a healthcare FSA. But again, as far as the use-or-lose is concerned, the way out-of-pocket cost expenses are going up, wow, no one's going to be in a position. It can be used not only for healthcare, it can be used for dental care and for vision care, to reimburse expenses. Those are my recommendations.
That's awesome. Awesome. Great list, Ed. Great comprehensive explanation. Folks, this is why there is only one Ed Zerndorfer. And we're so happy he's with us. Another great article, Ed, on behalf of all Feds. Thank you for being such a great resource.
My pleasure. It's always a pleasure.
Folks, that's a wrap. We are serving those who serve. There's only one of us, too. Be sure to subscribe to this podcast on your YouTube channel and Spotify. And please remember to share it with friends and strangers, especially this one. This is such a great primer. Let's get this humming around the whole world, because this open season, more than any other, it's not the time for set it and forget it. Okay. Don't forget our live webinars every week. Just go to swserve.com. You will see the webinar button, hover over it. It changes colors. Click on it, and then you'll get the whole menu. Yes, the guru will come to you to reach you where you are, teach you where you are, and above all, serve you where you are. Sign up for one, sign up for all. Share that page with your friends. I promise you they will thank you. And don't forget, read Ed's article too. That matrix is amazing. He always puts such great charts and support material into it. It really rounds things out. You can find that at fed-zone.com, also at the SWServe website. So for Ed, the crew at Serving Those Who Serve, and me, Dan Sipe, closing out as I always do by saying, good luck, Godspeed, and above all, remember, it's your Fed life. Please make it a great one, because you do deserve it. Stay well, everybody. We are out.